Have you ever felt this way? You are sitting in your favorite chair, reading, resting, or simply enjoying a quiet moment when suddenly your heart feels a little off. Maybe it skips a beat, flutters softly, or gives you a brief wave of dizziness that settles before you can name it. You tell yourself it is age or stress, or maybe that you stood up too quickly, but those tiny moments are often the body's earliest attempts to get your attention. One of my patients once shared a story that has stayed with me. She told me she would sometimes feel a quick flutter in her chest, followed by a short breath she could not fully catch. It lasted only a second, so she pushed it aside. She said it felt too small to be trouble. But later, she learned those small episodes were early signs of a silent arrhythmia that had been putting her at serious risk of a stroke. I want you to imagine this. Your heart is not just a muscle that pumps blood. It is an electrical system, sending signals every second to keep your rhythm steady. When those signals falter, even for a moment, your brain feels the change immediately. If the rhythm becomes irregular, blood flow becomes unstable. And when the brain stops receiving steady blood and oxygen, the risk for a stroke increases long before any pain or dramatic symptoms appear. That is why these quiet changes matter so deeply, and why so many seniors overlook them. In more than 30 years of caring for older adults, I have seen how weather shifts, dehydration, medications, or simple daily stress can make these irregular rhythms more noticeable. The heartbreaking truth is that many of my patients realize the connection only after experiencing a stroke. In this video, we are going to explore the silent stroke causes hidden inside irregular heart rhythms. You will learn the early warning signs, the patterns you should never ignore, and the daily habits that protect your brain and your future. Before we move into the next part, please subscribe, like, and share Senior Health Daily. Your support helps us keep creating life-saving education for our community. Why silent heart rhythms can lead to stroke. When we sit down to eat or enjoy a quiet moment at the table, we rarely think about the extraordinary work our body is doing behind the scenes. Eating seems simple, but it requires a complex orchestra of muscles, nerves, blood flow, oxygen delivery, and precise timing from the brain. What many seniors don't realize is that this same orchestration depends heavily on the heart's electrical system. When the rhythm falters, even slightly, the brain feels the imbalance long before we are fully aware of it. I have cared for older adults for more than 3 decades, and I can tell you that silent heart rhythm issues are some of the most dangerous and most frequently overlooked stroke causes. Irregular beating, even if it lasts for only a few seconds, can temporarily disrupt the steady blood flow the brain depends on. When the heart pauses or flutters, oxygen to the brain dips. This momentary drop often creates what I call brain micro-delays. They are small, almost invisible misfires in brain function. Many seniors describe it as a brief moment when they lose their place in a conversation, cannot remember a word, or feel a quick wave of lightheadedness that fades before they can make sense of it. Silent arrhythmias, including atrial fibrillation and micro-misfires in the heart's electrical pathways, are especially dangerous because they create the conditions for blood clots. When the rhythm becomes uneven, blood has a tendency to pool inside the heart, especially in the left atrium. This pooled blood can form tiny clots. Sometimes these clots stay where they are, but other times they can travel to the brain and block a vessel, causing a stroke that seems to appear out of nowhere. This is why eating often reveals symptoms that walking, resting, or even exercising may not. During meals, the body is multitasking. The digestive system demands more blood. The brain coordinates swallowing, breathing, and awareness. If the heart is struggling to maintain its rhythm, the brain's workload increases. That is when symptoms become more noticeable. I remember a man who came to me after months of experiencing subtle throat clearing during meals. He believed it was allergies or dry food. But he also felt a tight pinch in his jaw and a momentary blur in his vision during dinner one night. We later discovered he had been experiencing silent AFib episodes. Not long after, he suffered a transient ischemic attack. He never imagined these tiny signs were connected to a heart rhythm issue that was quietly increasing his stroke risk. Another woman told me she noticed her hand trembling while lifting a spoon. Her family believed she was simply tired, but she admitted she felt a strange flutter in her chest just seconds before the tremor. Her exam revealed intermittent arrhythmias that had been placing her at risk for months. She was lucky enough to catch it before a major stroke occurred. Silent rhythms are dangerous precisely because they pretend to be harmless. Hidden stroke warning signs. During heart rhythm changes. One of the most important things I want older adults to understand is that early stroke warning signs can be incredibly subtle, especially when they stem from irregular heart rhythms. Most seniors imagine a stroke as something dramatic, sudden, and unmistakable. But many early signs whisper rather than shout. Some people feel jaw or facial tightness while eating. Not pain, not choking, but a quiet tension that seems to pull the muscles slightly more on one side than the other. Others feel a moment when their swallowing changes. They are not choking. They are not eating too fast. But something about the movement feels different, slower, or harder to coordinate. One of the most overlooked signs is the blank, quiet pause that happens mid-meal. A person might stop chewing, stare ahead for a moment, or feel confused for 1 or 2 seconds, then continue eating as if nothing happened. These pauses reflect tiny oxygen dips to the brain caused by rhythm changes in the heart. Some seniors notice sudden weakness in the hand holding their fork or spoon. They may drop food accidentally or find their fingers stiffen without warning. Others experience short bursts of blurred or double vision. They blink, and suddenly everything returns to normal, so they assume it is nothing. Excessive yawning during meals is another surprising sign. It can be the body's way of begging for more oxygen. A strange pressure inside the head, like a gentle squeeze, can also signal early neurological stress. The reason so many seniors ignore these signs is because they seem to have simple explanations. Dry food, eating too fast, feeling tired, not paying attention. Aging, but these excuses hide the truth. The body does not make mistakes in its signals. These early signs often appear 24 to 48 hours before a major stroke. The most heartbreaking moments in my career are when patients tell me, "Looking back, I did notice something, but I didn't think it mattered." The difference between choking and stroke signals. Many caregivers confuse stroke-related swallowing problems with choking, but choking is mechanical. It is loud, violent, and obvious. A piece of food blocks the airway, triggering coughing, gasping, and panic. Stroke-related swallowing issues are the opposite. They are quiet, they look like hesitation or weakness instead of distress. A person may stop mid-swallow. Food may remain in the cheek instead of being moved to the back of the mouth. The throat may feel slow or unresponsive on one side. There may be no coughing at all. I once cared for a man who appeared to be choking on soup. His family rushed to help him, but what he actually lost was the swallowing reflex on one side of his throat due to a mini stroke caused by a silent arrhythmia. He was not choking. He was losing neurological control. These small differences matter. They save lives when recognized early. Why irregular heartbeat strokes happen more in seniors. Aging changes the brain and the heart in ways we do not always notice. As the nervous system slows down, the heart becomes more sensitive to dehydration, temperature changes, stress, and medications. Seniors often experience reduced blood flow to the brain during digestion, making them more vulnerable during meals. Blood pressure also spikes during and after eating. For younger adults, these spikes are manageable. But for seniors with stiff vessels or hidden arrhythmias, these changes can trigger dangerous conditions that lead to stroke. Medications complicate this further. Diuretics can cause dehydration. Beta blockers can affect the heart's electrical response. Antidepressants and sleep medications can alter alertness during meals, reducing awareness of early symptoms. Small vessel disease, common in older adults, makes the brain less resilient to oxygen dips. Diabetes affects the nerves that control swallowing, increasing the risk of silent signs being missed. Age is not the enemy, but age changes the body's speed and resilience. And when the heart falters, even briefly, the brain feels it immediately. Most people do not realize how common rhythm-related strokes are. In the United States, atrial fibrillation is responsible for more than 1 in 7 strokes. Yet millions of seniors have no idea they even have it. Hospitals also report higher rates of transient ischemic attacks after lunch or dinner, especially in older adults with known heart issues. Meals are a vulnerable moment for the body. Seniors who live alone face the highest risk because there is no one there to notice subtle signs. A small pause during a meal goes unseen. A brief jaw tightening is forgotten. A dropped fork is dismissed. These missed moments accumulate until it becomes too late. Silent heart rhythm strokes are real, and they are deeply underreported. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Practical guidance to prevent stroke from silent heart rhythms. Stroke prevention does not require dramatic lifestyle changes. It begins with awareness. Eating slowly helps the brain stay in sync with the body. Staying hydrated keeps the blood from becoming too thick. Checking your blood pressure before and after meals provides clues about your heart's workload. Sitting upright and relaxed protects the swallowing reflex. Avoiding very heavy meals reduces strain on the heart and digestive system. Recognizing facial asymmetry in real time gives you a powerful early warning. Families and caregivers should learn what to look for. If an older adult pauses mid-meal, drops food, stares blankly, experiences facial drooping, or cannot swallow normally, do not wait. Seek medical attention immediately. I once helped a family who noticed their grandmother quietly pausing while eating. She insisted she was fine, but they trusted their instincts. Hours later, she was in the hospital, and doctors confirmed she had been experiencing early signs of a stroke. Their quick action preserved her speech and mobility. Stroke prevention is not about fear. It is about listening to your body. It is about giving your future a chance to stay strong. As we come to the end of today's conversation, I want to bring us back to the truth that sits at the heart of everything we have talked about. Your brain carries every memory that shaped you and every face you love. It holds the moments you cherish most, the stories you lived, and the wisdom you earned over a lifetime. That is why understanding what your heart is doing in silence matters so deeply. Heart rhythm issues may be quiet, but their consequences never are. They whisper in small ways long before they send a louder cry for help. Awareness is one of the greatest gifts you can give yourself. When you understand what silent stroke causes look like, you give yourself the power to protect your independence, your mobility, your speech, and the dignity you deserve as you age. Knowing what your body is trying to tell you allows you to act early, to stay steady, and to stay present for the people who love you. I often think about a patient who came to me after a stroke that changed her life. She looked at me and said, "If only I knew these signs earlier, everything might have been different." Her words have stayed with me, and they guide every conversation I have with seniors today. You deserve to know the signs, you deserve to understand your body, and you deserve the chance to stay strong. Thank you for spending this time with me and for investing in your health with such intention. Your willingness to learn, to listen, and to stay aware shows a deep respect for your own well-being. Be gentle with yourself, stay observant, and treat your body with the care it has earned after carrying you through so many years. Stay aware, stay hopeful, and remember that your health is worth protecting every single day. If this video helped you, please subscribe, like, and share Senior Health Daily so we can continue walking this journey with you.